I think this is where testing can be valuable too, because so many of us normalize our symptoms, or we think, oh, I'm just getting old, or oh, I'm just tired, or I'm just stressed. But when a doctor can look at your blood and actually show you, actually, you have more going on than you realized, and we can fix this. And there can be more than blood testing that helps with this. Many people with autoimmune disorders have gut issues. And there's a principle with immune function called molecular mimicry, where for a lot of our people with autoimmune disorders, they're also reacting to foods because their immune system is just on hyperdrive. When we can heal the gut and calm down the immune system in the gut, it actually improves their symptoms of whatever autoimmune condition they've got. And so finding a doctor who will help you do that general screening can really help you find and heal multiple things and things you may not have even known were wrong.
Hey everyone, Dr. Josh Axe here. Welcome to the podcast. This week we have Dr. Kate Henry on, and we're going to talk about testing. We're going to talk about autoimmune disease. We're going to talk about mental health issues. We're going to talk about how to use food as medicine and so much more on today's podcast. And again, I mentioned we have Dr. Kate Henry on. She is the head of medical education at Rupa Health and the host of the Root Cause Medicine podcast. Dr. Kate collaborates with clinicians all across the country who do, again, what I love, root cause medicine. And we're going to talk about a lot of fun stuff today. Also, Dr. Kate's training in naturopathic medicine, biofeedback, and nutrition really allow her to do what we should all do as physicians. Unfortunately, a lot of people aren't doing this, but getting to the root of the problem, which we're going to get to today. So excited to dive in. Dr. Kate, welcome to the show.
Thanks for having me. I'm honored to be here. I love what you're doing in the world to help so many people heal.
Great. Hey, well, thanks so much for that. And again, I love what you're doing to help people heal. And I know before we started recording, I wanted to find out a little bit about what got you into this space of natural health. And I find this all the time, but the stories are always so unique. It's typically a health crisis for themselves or someone they love. But share with us, before we dive into testing and nutrition and all the things, what got you involved in the field of natural medicine?
Absolutely. So I was a pretty sick kid. I had belly aches every day, anxiety, depression, insomnia for 10 years from ages 11 to 21 until I met a functional medicine doctor who diagnosed me with celiac disease. And within 3 days, my symptoms disappeared. And after that, I was hooked. And I thought, wow, for the last 10 years, I have fought every day just to feel normal. And someone lifted that off of my shoulders. And now I feel free. And I just wanted so deep in my bones to give that to as many other people as I could. And so I asked my doctor, who was an MD, how do I do this for other people? And she said, if you want to learn root cause medicine from the beginning, you should go to a school like a naturopathic school. They're going to teach about food as medicine from day one and herbal medicine from day one. And so that's where I went. And when I got out, I dedicated my career to helping people with mental health issues and mystery illnesses to find and heal the root cause.
Well, mental health issues are rising faster than any other condition that I've seen lately. I mean, when you look at cancer and diabetes and obesity, well, those have been increasing for many years. Mental health issues have gone up. I mean, just skyrocketed. And so, as you mentioned, it could be everything from gender identity to anxiety to depression to I was actually reading this article recently, and they said the number one search term right now on Spotify is the word sad, like for this generation, because there's so much sadness and loneliness. And so, one of my first questions for you is, what's that connection between our biochemical markers, blood tests, nutrition, the whole field of natural medicine, and our mental health?
Absolutely. I mean, what you're saying about the rise is backed up by the research, actually. So typically in America, 1 out of 5 people will have a mental health disorder in a given year. So 20% of us. But during the pandemic, that number rose to 40%. Wow. We already have a system that is overburdened and not capable of caring for everyone, using the things that people typically think of as treatments for mental health, right? Psychiatry, pills, therapy. And so right now in America, half of the people do not have enough access to a psychiatrist or a therapist because of the county they live in, right? 150 million people don't even have a single psychiatrist in their county. And so we need more answers. And what's interesting is the answers are sitting in the journals of psychiatry. We have papers over the last 5 to 10 years that have been published that establish that the root causes of mental health disorders are inflammatory. They're related to nutrient deficiencies, they're related to mitochondrial dysfunction, and they're related to hormonal dysfunction, and sometimes infection and immune dysfunction. We know this, right? You can look at someone's blood and look at inflammatory markers in their blood and predict how depressed they're going to be. If you look at things like F2 isoprosteins, HSCRP, which are markers of inflammation. The number one nutrient deficiency in the US is vitamin B6. And when people don't have enough of that, it's known to cause irritability and depression. So there are so many biomarkers, and I hope we're going to dive into this in a deep way in this whole podcast. But the truth is that we know that mental health disorders have a huge biochemical underpinning. And so what I did before I came to Rupa Health was work in a practice with 80 therapists. And together, along with naturopathic doctors and registered dietitians, we helped people heal by bringing the body back in to mind, body, spirit care.
It's so good. I really believe that this sort of, I call it mindset medicine, is so important. And, mindset's important. Our spiritual health, our mental health is really important. And obviously, I think there's a level too of, I think it's a combination of things. I think diet and nutrition is a big part of it. I also think people not knowing their purpose, having a confused identity, these real world sort of cultural issues play a big role. But there's no doubt, as you mentioned, certain deficiencies, you mentioned B6, that's important for a lot of things, even pregnancy. I know when my wife had some morning sickness, we had her up her doses of magnesium and B6, really did some amazing things there. So, these nutrients are absolutely critical. A lot of the B vitamins and certain minerals and fats and things like that for mental health. You mentioned blood work. And one of the things I'm a big believer in is blood work. In fact, I typically get panels done every year. In fact, I just had mine done last week. And there's certain things I like to look for. I always do some sort of like a micronutrient panel where I look at every vitamin and mineral I'm deficient in. And the crazy part to me is, when most people go to their conventional MDs today and get any blood tests done, it's things that just really are, people are maybe looking for something radical like a cancer or lymphoma or some sort of issue, but they're not looking for these deficiencies that cause us to be fatigued and cause infertility and lack of energy and brain fog and some of these other issues. And so all that being said, I'm a huge fan of getting testing done. And I want to mention this because I know I'm going to get this question. Dr. X, hey, where should I go to get testing done? I actually have, there's a group and Dr. Kate has worked with this group. It's called Rupa Health. And they do the best labs I've seen. They do really, really amazing lab work. And so if you're a person saying, I want to know what my deficiencies are, I want to know the vitamins I'm deficient in, the minerals, because you know how many people waste their time, Dr. K? I know I'm preaching the choir, but how many people waste their time like, oh, I'm going to take vitamin C, or I'm going to take vitamin D, or I'm going to take magnesium. But what if you already have plenty of that, but you're really deficient in something else, right? People do that all the time. So I want to encourage everybody, if you've never been tested, just blood work. It's actually not that expensive. There's great deals. You can go and get this done, or at least it's worth so much. This is why I do this almost every year. But Rupa Health, I want you to talk about that for just a minute.
Absolutely.
But get blood work done. It's really easy. So talk about Rupa getting blood work done. But then after that, what I'd like you to do, Dr. Kate, is I want you to really dive in and do a deep dive on some of the blood work, the biggest things people should be testing for and why.
Absolutely. So I think everyone has had the experience of going to the doctor and wishing that the doctor would do a deep dive, right? Look at their microbiome, look at their genetics, look at all their nutrients. And they wonder, why doesn't my primary doctor do this? And the answer really is the system that we have in America doesn't allow for that to be easy, right? Your doctor, in order to order you a stool test, your doctor has to sign up for a separate company other than LabCorp or Quest, where you're probably used to going to get your labs, right? Create an account, stock the kit, ship the kit to you. This used to be very hard for every doctor to do, especially if they wanted to order you something that was different, like a month-long hormone panel. The problem was the doctor didn't know how to get the test, didn't know how to get the test to you, and that it was really difficult to get and understand the results. And so what Rupa Health did is we came to functional medicine doctors and we said, what can we do that will make your life easier and your patients' lives better? And they told us, make it easier for us to get them these critical tests that will allow them to find the root cause. And so that's what Rupa has done. So we envision a world in which you can walk into any doctor and ask them to test anything you want, and they can. Because right now we have a lot of amazing doctors who are just overwhelmed, overburdened, and who are being told, right, their priority is to make sure you're not going to die of a stroke. So they're only going to.
One question is, if somebody wants to go and get a panel done, where do they go, or how would they get this done?
They would find a functional medicine doctor who's using Rupa Health and then see them. A lot of
Is there a website? Like, where would they go?
Absolutely. So rupahealth.com, it's just RUPA health.com is where they can get started. And so they might even want to start on our magazine, because that's going to educate them about their condition and what they should consider testing for. And often they can actually bring that to their doctor, and then their doctor can help them, right? So maybe they'll read our work up on root causes of fatigue, print that out, bring that to the doc, and they've got their list of labs right there, and it's very easy to get done.
So RUPA, rupahealth.com, you can go get tested. Let's dive into, Dr. Kate, some of the most important tests people can get done and why those are important.
Absolutely. So we have really firm evidence now that nutrients are as effective as many pharmaceuticals for treating mental health disorders. Great example. There was a study done that followed people who were actually in recovery from substance abuse, and they got either 3 grams of omega-3s or placebo for 6 weeks. And at the end of those 6 weeks, the people who took omega-3s had a 50% reduction in anxiety and anger compared to the people who didn't get them. And so a lot of times we think about medicine, and particularly psychiatric medications, as coming in a pill or a prescription, when really we can use nutrients like omega-3s to have even better results. And what's beautiful is you can actually use both. So checking your omega-3 status is one of the first steps to figuring out if you need more omega-3s. But most people don't know how to do that. So one of the ways that you can do that, that's pretty popular. And I want to hear from you, Dr. Axe, because I know you have a wealth of information about this topic. But one of the ways that you can do it is with a red blood cell omega-3 index. And what that's going to look at is how much omega-3 is stored in your red blood cells. And the reason we check that is because your red blood cells tend to live about 3 months in your bloodstream. And so they reflect how much of that nutrient you've had over the past few months, versus just measuring serum omega-3, which might just show how much you have from your latest meal.
Yeah.
That's one example.
And this is really important stuff, is that you're getting not just blood work, you're getting the right things done, and things that look for more of those long-term deficiencies, looking at truly, looking at the longer term A1C or some sort of blood sugar levels, right? Looking at these omegas where you're looking inside the actual blood cells you're mentioning, and not just what's in your bloodstream. And so I absolutely agree with you. I love doing omega panels because, being able to see that omega-3 ratio is really important. Can I tell you just personally? So when I was young, I was diagnosed with ADHD, and I had a real problem learning in school. In fact, I graduated high school with a C- grade point average. I mean, I barely graduated high school because I just had so many issues. I started learning about nutrition in college, and I started changing my diet. And then I started supplementing it with, I remember, because I started reading about it as I started learning in college and taking nutrition courses, I read a medical study on omega-3 fats and B vitamins. And I started taking these specific B vitamins mixed with an omega-3 supplement, changed my diet, and I could focus. I mean, my ability to focus went up tremendously. And so there are probably even people out there, you mentioned ADHD is another example. I mean, that one can really be improved if you're taking some of the right nutrients. But keep going with some of the other testing you think is important.
Let's stick with that, actually. So folks at home, I want you to think, if I asked you, what 2 nutrients do you need to make dopamine? Do you know?
You're asking me. Oh,
you're asking
everybody.
everyone.
Go ahead.
I know that you know this, Dr. Axe. It's tyrosine, which is an amino acid, and B6. When you combine those, you get L-DOPA, which is converted into dopamine. That's it. It's that simple. It's in our nutritional biochemistry textbooks, but it's not making it into the clinic. And so when we have kids with ADHD or adults with ADHD come in the clinic, what's not happening is that a psychiatrist is checking them for B6, checking their blood urea nitrogen to see if they're consuming enough protein. They're not looking at their diet, and they're not teaching them how to get those foods. And again, guys, this is not intentional. This is because it's just not the way our system is set up. And this is why Rupa is coming in and trying to make it easy for every psychiatrist in America to click one button and check your root cause. So,
You know, one other thing I love about what you all do, because I started looking into Rupa Health and learning more about what Rupa does and why their testing is so unique and why I really like it. But, I think one other thing that when you go and see the right type of functional medicine practitioner, I remember reading a study years ago at Stanford, and they found that people that were taking certain B vitamin supplements, sometimes they weren't actually absorbing a lot of those nutrients. And they found that when those patients started supplementing that didn't have healthy gut microbiomes, when they started supplementing with probiotics, their rate of B vitamin absorption went up radically. Like I see people all the time getting things like B vitamin 12 injections every single week, and still their B12 levels aren't normal. And sometimes it's not just the nutrient, it's that thing that's responsible for nutrient absorption or the conversion, right? So anyways, you mentioned the microbiome earlier. I just wanted to point that out because we need B6, we need dopamine, we might need probiotics too. And that's why it's important to do kind of ideally something where you're doing more holistic and expansive testing.
absolutely. That includes looking at the whole person, every organ system in their body, what they're eating, right? Because that's what it truly takes to heal. This is why whenever I talk to registered dietitians and nutrition professionals, I'm so passionate about making sure that they know that they are the answer to the mental health and chronic illness crisis we're having in America. And we're leaving them out of the conversation right now. So often we're just talking to psychiatrists and psychologists, and the RDs and the nutrition professionals aren't even in the room. We need to start bringing them in the room because they have the medicine that people need to heal.
That's right. That's so good. Let's talk about a few other conditions. We talked about dopamine. By the way, this is a big one. If you're struggling with sadness and loneliness and depression, especially, you need to look at your dopamine levels, and you need to consider, again, look at certain nutrients that could be causing an issue there for you. That's where this test is really good. I want to talk a little bit about chronic pain. There are so many people today living in chronic pain. You mentioned inflammation earlier. Talk about have you any experience with patients or people you've worked with, and when you were able to find out those inflammatory markers, what are those inflammatory markers? What do we need to look for, and what are some things people can do? But how important is that to chronic pain?
It's vital. Let's dive into the biochemistry a bit, guys. So there's two biomarkers that we know are elevated in people with chronic pain, but also psychic pain, right? Think about it. What is depression? What is anxiety? You're in pain. You may not be in like physical pain, but when we look at these two biomarkers, we see that they're elevated in people with both chronic physical pain and chronic mental pain. Those two biomarkers are things called HSCRP, which stands for high sensitivity C-reactive protein, and F2 isoprostanes. And essentially what those are reflections of is how much inflammation is in your bloodstream. Now, I want to drill into inflammation because I think my patients heard the word inflammation and it sounded kind of like this mystical fire kind of running through your arteries and veins. Inflammation is chemical. And so I want you guys to picture this. Stick with me. There's a molecule called arachidonic acid. Just think of it as an AA. It gets converted into chemicals called prostaglandins, leukotrienes, thromboxanes, and those create inflammation in your tissues. When you take ibuprofen or Tylenol, you interrupt that thread. So you prevent arachidonic acid from being converted into those inflammatory mediators. But you can do the same thing with omega-3s. You can also do the same thing by loading your bloodstream full of antioxidants, which will help to reduce levels of oxidative stress and inflammation in your bloodstream. So tons of fruits and vegetables, a lot of the ancient nutrition things you're going to get from Dr. Axe are full of antioxidants. That's why they're so healthy for you. So this is where when we talk about food as medicine, this is what we mean, right? Loading your body full of antioxidants. The only way to do that is food. So Dr. Axe, you have your tables and charts. I've seen them. I've shown them to my patients that are high in antioxidants. What do you typically tell your folks about, like, where do they get those in their diet?
Yeah. And by the way, I've worked with so many people with chronic pain. I at one point herniated a couple discs, had major issues myself. And so the diet that I recommend people follow is mainly this. It's meat that's organic and wild. It's vegetables. It's healthy fats, and it's berries, loads and loads and loads of berries. And if you can focus on those areas, you're going to do wonders for yourself. And so I would say, of course, wild caught salmon, grass-fed beef, things like that. And then, mentioning vegetables. I think cooked is just as good as raw. So, but doing a mix of both for most people, unless you have gut issues, then you want to do only cooked. As I mentioned, healthy fats, avocados and olives and coconut oil, things like that. And then again, I would do also a lot of herbs and spices. That would be the kind of fifth category there. You're going heavy on turmeric and ginger and rosemary as we're talking about that. And then supplementally, I tend to like those omega-3 fats. I like turmeric with some black pepper or curcumin. And there could be loads of others. Even chaga mushroom has some benefits there. But those would be some of the ones I would say. But, I think for a lot of people, they don't necessarily know what their inflammation levels are. By the way, the thing that I love about what Roop is doing is you guys are doing the better testing. There are some people out there doing CRP testing, which is great, but the fact that you're doing the high sensitivity C-reactive protein, it's just a much better indicator, especially for those healthy. There are some people that generally they eat pretty good. They might have even heard me say they're like, well, Dr. Axe, I eat a lot of those foods, but I still have these, mental health issues, or my joints still feel like not as good as they should. That's where the high sensitivity C-reactive protein will really help. And then there's some even more aggressive natural anti-inflammatories, because maybe you're taking 500 milligrams or 1,000, but maybe you need 3,000. Sometimes I've seen this with a lot of people, they're not doing enough, especially some of those health enthusiasts. That's why, especially for the health enthusiasts, you've really got to dive in and figure out what's going on. That's why blood testing can be so helpful.
Yeah. What dose do you need? It's not just taking it, it's figuring out the ideal dose that's going to work. Absolutely.
Yeah, that's big. I want to talk a little bit about autoimmune disease. This is another big one that we see with a lot of people. Are there any markers, just any single ones that you look for if somebody is having any sort of, now inflammatory markers might show up too, right? The even high CRP. Is there anything else that you look for with autoimmune issues?
Sure. So an ANA panel is going to screen for most anti-nuclear antibodies, which is a general screening to detect, is your body making antibodies that are going after your own tissues? You could start there. A lot of people will then order more specific testing depending on what organ they're concerned about. So maybe somebody for the first time in their life gets diagnosed with hypothyroidism and they have no idea why. Your doctor can order specific thyroid autoantibodies to check, is your immune system attacking the organ that's not working, right? And so this step is often missed when people get first diagnosed with an issue, right? We figure out, okay, your thyroid's not working, we move on, we give you thyroid medication. You really have to see a functional medicine doctor or root cause medicine doctor most times to get them to dig deeper to figure out why. What do we need to treat here? Is it that we need to treat the thyroid and or the immune system? And that can make all the difference in your outcomes.
Yeah, that's really big. It's really big. So with autoimmune disease, as Dr. Kate is mentioning here, it's good to know these markers. A lot of people have thyroid issues or even autoimmune like Hashimoto's, and they don't know it because they've never been tested for it. And so, and I've also found this too, and Dr. Kate, tell me if you've found the same thing. If you can catch some of these early, it's actually easier to treat. Like you can turn it around faster. Now, I found even if people are pretty far down and have major issues, you can turn it around. It just takes longer. But if you can check some of this stuff early, you can turn it around even faster. And so I wish people sometimes wouldn't wait so long. It's like, listen, start taking care of yourself now. Don't wait until it gets that serious or that hard to fix.
Well, I think this is where testing can be valuable too, because so many of us normalize our symptoms, or we think, oh, I'm just getting old, or oh, I'm just tired, or I'm just stressed. But when a doctor can look at your blood and actually show you, actually, you have more going on than you realized, and we can fix this. And there can be more than blood testing that helps with this. Many people with autoimmune disorders have gut issues. And there's a principle with immune function called molecular mimicry, where for a lot of our people with autoimmune disorders, they're also reacting to foods because their immune system is just on hyperdrive. When we can heal the gut and calm down the immune system in the gut, it actually improves their symptoms of whatever autoimmune condition they've got. And so finding a doctor who will help you do that general screening can really help you find and heal multiple things and things you may not have even known were wrong.
Yeah, that's so good. I want to talk about another area too here. And this is, I have a close friend of mine who lived in a house that had mold in it, black mold. And it just wrecked her health, major issues. I mean, now she's doing some great stuff now and seeing some good improvements, but there's a lot of people exposed to mold, people that have maybe had a tick bite and have Lyme, and they don't realize that a lot of people with Epstein-Barr or CMV or even long COVID, right? There's a lot of these issues. Do you ever do any testing or recommend any tests for people? Obviously, with something like Lyme, we know what to do there. But all that being said, I mean, do you ever do any sort of testing to check for things like mold or yeast or viruses in any sort of blood work?
Absolutely. I mean, you want to really check on all of the burdens in a client's body, especially when they're doing everything right and they're not getting better.
Mm,
Often, those hidden things that are stimulating the immune system can be a component of that. Additionally, if you're nutrient deficient, your immune system may not have the ingredients it needs to work optimally. I mean, we know from studies
that's
of with
right.
looking at COVID, like people who were vitamin D deficient were more likely to have a serious illness because of the way it impacts the immune system. And so, absolutely, a really good root cause doctor is going to be looking at a lot of that. I know a lot of my clients would come in asking for those tests because they had heard about it on a podcast. But then when they went to a primary care or whoever, there wasn't the space to discuss it. And so, so many people are looking for these types of insights into their health. And that's why I'm so pumped that more doctors are going to be able to just say, yes, I can look at that for you. Absolutely. Let's run that panel. Let's run that test. Let's look at what else is going on in your body so we can heal those things up and give your body more time and energy to focus on healing the symptom you're coming in for.
You know, I personally found this with a lot of the Lyme patients I cared for is that when they went to other doctors, what most doctors did, and you said something here, I think it's really profound and important. A lot of times they would go to these doctors and the doctors would say, okay, well, we found you have Lyme. So they check for that and that's good. But then they would kind of maybe put them on some anti-Lyme. So just attacking the you know, Lyme, the bacteria there. And so that's what they would treat. And, but in my study of Chinese medicine and everything else over the years, one of the things I discovered is you don't just want to, you don't want to treat you don't want to only treat the disease. You want to strengthen the person, strengthen their body so they can actually fight off the disease itself. And not enough doctors have that mentality. That's really what root cause medicine is. And so what I used to do with Lyme patients was we might take a few things. There's numerous things like Japanese knotweed or whatever. We would do some things to treat the Lyme. And do some dietary things. But at the same time, I would try and strengthen the organ systems, the immune system specifically, because if your immune system's strong enough, it can kill off bacteria and viruses and parasites and all those things. So like one of the herbs I love to use was astragalus, because astragalus is one of those herbs that helps do that. Also doing some things for mental health was really important, because if somebody has a purpose and they get outside in the sun, all of these things are strengthening the immune system. So, but I just want to point that out because it's such an important perspective that even a lot of doctors in the natural space or even health coaches, they don't necessarily think about root cause medicine like you and I do in terms of, yeah, you got to treat the disease, but more than that, we got to strengthen the body because the body heals itself. The body can kill this off if we strengthen it enough. And one other thing I wanted to mention, and this is the first thing you mentioned when you mentioned a blood test, was you actually mentioned or before the blood test, you mentioned a microbiome test. There are a lot of people today struggling with gut issues, but talk to us about not just gut issues. Why would somebody get a microbiome test? And what are some things sometimes you found, maybe even conditions that somebody didn't realize were connected to the gut microbiome?
Absolutely. And when I say microbiome, I actually usually mean like comprehensive digestive stool testing, which includes microbiome testing.
Mm-hmm, mm-hmm.
So if you guys have ever gone to the primary care, maybe you got a really bad stomach bug. They probably ran a stool test for you, but it was checking for ova and parasites, really just infections. What a comprehensive digestive stool analysis will do is look at what are your enzymatic reactions in your gut looking like? Do you have enough stomach acid, for example, right? Do you have enough pancreatic enzymes? Then it's going to look deeper. Do you have markers of inflammation in your gut? Things like secretory IgA or calprotectin. Do you have enough of the good probiotics? Do you have too many of the bad bugs? And if so, what type? And some stool tests go even further and test for sensitivity. So if you have an overgrowth of a bad bug, they'll see what herbs is it sensitive to, what medications is it sensitive to, so we can kill that off, but also strengthen the gut. And so it's a really comprehensive look at everything going on in your digestive system, not just infections. What I've been able to go ahead.
Well, no, I was going to say, so I've done this. So I had a stool test to test my microbiome, and it was fascinating. And this was years ago, but similar to the test that Rupa Health does. And it looked at, and I remember finding that there are certain herbs that would work effective for me I had a my gut was generally pretty good, but I had one bad uh, form of yeast we needed to kill off. And I remember it showing that things like olive leaf would be very effective for me. But surprisingly, like oregano was not effective at all for me. And so some people might think, oh, I've got mold or I've got candida, so I'm going to do a bunch of oregano. That might work great for you, but it might not. There might be another herb out there specific to your unique body that is going to be much more effective. So that's what I love about this. I do want to mention this too. If anybody's listening to this and you're saying, hey, I want to get a blood test. And again, for me, by the way, I have not been to, this is going to sound terrible, maybe. I haven't been to a regular kind of doctor checkup outside of, I had this issue last year, which is kind of a crazy story. I got a spine infection and had to see, actually, I guess that was my first doctor in almost 20 years, but I hadn't seen like a traditional doctor since I was probably like 19 and I'm 42 now. All that being said, this is the way that I keep myself healthy, is doing these tests. And so if you're saying to yourself, hey, I think, I want to get some sort of test done. I want to be able to get my blood work or my microbiome test. You can go to Rupa Health. Remember, it's rupahealth.com. Check out Rupa Health. Again, this is a place that I love to go. And by the way, there's some other great stuff on there. You can get food plans. They got a great magazine. So if you want to learn about some of these things, and if you're a person, listen, I know we have all kinds of people listening to this podcast, but if you're one of those people, you love learning about advanced nutrition, you love those principles, there's some really good stuff on there. Again, you can go to rupahealth.com and find somebody that does a blood test. Just check out the labs area, and you can get that done. But let's jump back into it. Sorry to interrupt you. I just thought that was so important because a lot of people don't realize how sophisticated some of this testing is. And there's nothing I hate more than thinking, oh, this food's probably good for me, when it may actually not be doing me much good.
And that's actually the power of testing, right? Is figuring out, like I used to say to folks, like, when are the right foods wrong for you? And that's something that you'd never know from reading a book. You have to discover it by looking at your own biochemistry and biomarkers. And you have that right, particularly if you're in a body that's got a chronic illness. Getting to know what's going on in your body is so vitally empowering and important as a step in your healing. I wanted to mention, we have something at Rupa I'm really proud of, and it's called the lab comparison tool. And so what people can do is type in gut health test, and they can compare all the different types of tests available on the market to them, what each of them includes, how much they are, so that you could start to decide, do I need the $100 one that's going to test for 3 things? Or do I want the more expensive one that will tell me more about sensitivity and infection and inflammation? Now, this is a conversation that I really love when people have it with their functional medicine doctor, and their doctor can lead them through this. And that's where we really start to get more of that informed consent, and people really start to get the education and the tools they need to heal themselves.
That's so good. One of the things that I'm a part of is it's something called the Health Institute. And what we do is we actually certify nutrition coaches to go and get trained. And part of what we do is actually lab work training, because we know it's the future. Like, this is what people need to know about in terms of, like, when I think about, if I'm going to send my mom somewhere, for instance, and I want somebody to take care of my mom's health. Now, my brother is a functional medicine practitioner in Tampa, Florida. And so my mom's in Florida, so I actually just send my mom to my brother. But anyways, this is all the testing. This is what my brother does. He's a functional medicine doc, and so I will. But again, all that being said, it's like this is the sort of thing I'm sending my family to. Like, I just had my mom and my dad get these panels done. And like we saw with my dad, he had Epstein-Barr virus. Like, that seemed to really show up really high on him. So we have him on certain supplements. His energy was low. We're also working on his testosterone. So we gave him certain herbs like ginseng and a lot of these herbs that really help with testosterone. Fenugreek was another one. Changed his diet a bit. And people start to notice most of the time, even after a few weeks, when they're eating the things that are right from them and taking the actual right vitamins rather than things they don't need, they'll notice a real difference. And so I've experienced this a lot in my own family, even with my own parents. Once I send them to my brother to get their blood testing, blood testing and stool test done actually as well.
Once you know what you need to treat, and then you figure out how to treat it, there's no stopping you, right? And it's just, that's what people are missing, is the insight and the tools.
I want to say my one of my best friends, Jordan Rubin, and he co-founded Ancient Nutrition with me. He has a saying, and it's so good. He said, "It's not a miracle; it's just missing." It's this thing of like vitamin D. If you live in South Florida and you lay out every day and you take a vitamin D supplement, you're probably not going to notice a difference. But if you live up north anywhere or even in the middle of the country and you don't see the sun for a good part of the middle of the winter, and then you take vitamin D, for some people, it feels like this miracle, but it's just missing. And that's how a lot of vitamins are. Like, here's another one. I'm sorry I'm sharing all these personal because I've experienced this so much. I was having this lack of energy. I used to do triathlons, and I would have this thing where I would stand up and I would get lightheaded. And when that happened, I thought, gosh, what's going on? Finally, at one point I said, I'm going to do a blood test. And it was the most random thing. I was really deficient in vitamin B2. And after this blood work, because it was one of the only things. I was actually deficient and borderline in a couple other things, but I was really deficient in B2. And I started taking it, and boom, all of a sudden, boom, it was gone. And I thought, I wish I would have tested for this a year ago when it started. It was one of those things. It's just.
Yeah, I have a similar saying. It's like it feels like magic. It's just good medicine, right? And
There you go. That's
we
good.
just need more of it. And guys, I mean, there's really only 80 to 100 micronutrients that make or break human health, right? Vitamins A through K, minerals, calcium through zinc, amino acids, omega-3s, and then obviously your macros. And I know you guys talk about this a lot on the podcast, but if you master those and you get enough of those, and then you check to make sure they're actually showing up in your cells in your bloodstream, your body's absorbing them, so many things will heal. I mean, we have so many case studies. The two of us could talk for hours about patients where we just figured out their nutrient deficiencies and fixed them, and their previously incurable disorder got better.
And I see this with the gut microbiome all the time. I remember I had a patient come in. I kind of referenced this earlier. She was getting vitamin B12 injections. She was taking, so this is going to sound a little, anyways. She came in with 2 whole food bags full of supplements. I mean, I'm talking about, like, have you ever had anybody come in with, like, I think she was taking like 80 pills a day, 80, 100. And I told her, and she had this sort of personality. It was okay. It was like our second visit. And I said, you have really expensive urine, probably. I said, you're taking so many things. And so I said, we need to check some things. My gut microbiome checked it out. That was the big issue. So we started her on probiotics, just really high. And here's the other thing. A lot of times people don't do high enough dose or the right strains. Really high dose, triple dose at least, of probiotics. And after a month, she's like, I feel like a totally different person. She didn't need her B12 shots anymore. Actually, she saved money because she got this blood work done. It's like she wasn't spending all this money on all this stuff she doesn't need. So anyways, I was excited to talk to you today because we don't talk about lab work a lot, but I really think it's so important. And now the testing is so fast and so easy for people, and and it's even more accurate, that it just, anyways, it's something, again, it's the reason I get it done on a regular basis. I recommend people get it done regularly. It's obviously can be really important. I also know we have a lot of medical doctors and chiropractors and naturopaths and just physicians and also health coaches who listen to the podcast. Any advice for some of those docs who are wanting to maybe they haven't done much testing, but they want to sort of get more into doing this sort of root cause medicine like you and I practice?
I would actually say to go sign up for Rupa Health because it's free. So practitioners just sign up. Yeah, free for practitioners. So sign up. And what's going to happen is you'll get put in a system where all you have to do is push one button to order any test in the world. That's going to make it easier. Step one, right? Where you can just type in vitamin D, click, boom, it gets delivered to your patient's house. They go draw it, or they go take it to LabCorp or whatever. The other thing is, when you're in the system, we can educate you, right? So like we'll send you newsletters on how do you test the microbiome. You can use the lab comparison tool to start to learn for yourself. What are my options for testing? Which one would be appropriate for my client? We actually have a whole education program called boot camps, where we give practitioners a comprehensive test kit for themselves. And so they get the kinesthetic aspect of like, ooh, let me run this on myself. Let me feel how it feels to collect it. Let me figure out my own microbiome. And then we give them 6 weeks of material and mentorship, usually with a high profile doc, to walk them through what it means for their health and how to apply it for their clients. You really need that before you just start ordering these tests, because often they come back and there's a lot of information. And if you don't know how to use it, it's hard to use it to help your client, right? Like if you don't know about probiotics or you don't know about calprotectin and secretory IgA and what they mean about inflammation, then you feel really overwhelmed. And so our goal is to really make it easy for providers to order these, but also train them about when do you use it? How do you use it in the most evidence-based, effective way?
That's so good. So good. I'm gonna call my brother after this, and because he may already be using Rupa Health, and then I've got one of my best friends, Dr. Christopher Motley. He does a lot of testing with people too, and so this is going to be something good for them to practice and start using. I know they already do a lot of blood work again because it's so important today to be able to find out exactly what's going on, and I love it. Hey, last couple questions for you. What you know there. This stuff is changing so rapidly. You know, I was talking to somebody. I love using Aura Ring. I don't know if you've ever used Aura Ring. It's like a ring tracks your sleep, and I also love I love Apollo Neuro. It's another just awesome app that, anyways, it's good for mental health, the way that tests. So I love testing and tracking. But also in regards to blood work, what are some of the new things that they're able to test for maybe today that we weren't able to test for as accurately 5 years ago?
It's interesting. I just sat in on Cheryl Burdett's Precision Point lectures on their new food sensitivity and food allergies panel. It's pretty cool. And there's more panels like this, but it looks at IgG, IgA, IgG4 food sensitivities, along with some complement reactions to foods and IgE food allergies. And so I think what's happening is as we realize there's different types of reactions to food, we need to be screening for all of them at once, right? Don't make your client go get tested for allergies, then sensitivities, then complement reactions. No, do it all at once. It's really encouraging that these panels are getting more comprehensive, more affordable, and easier to access because we can get people better so much quicker than we used to.
By the way, I actually just had this test done.
No way.
And yeah, I did. And one of the things that was so interesting, so yeah, it's not like, so people have had this done, they typically will look for, let's say, IgG, or for more of a sensitivity, or anyways, and so or just for those allergies. And but this was, it was all four, and we were able to see all of those. And it was like, okay, well, certain ones I was sensitive to, but I wasn't allergic, or there was a couple I was allergic to, but I wasn't sensitive to. But one thing that's really helpful to look at is, okay, what am I across the board? Every inflammatory marker, or every reactionary marker, it's on high. So I have certain things, like my body just does not do very well with dairy. Like especially cow's milk. I mean, that's probably a lot of people. That's the one that shows up for me every time. But that was like across the board, right? It was like, Josh X, do not have cow's milk, ever. So when I even do some, like goat's milk didn't show up as much for me, and things like that. But it's so helpful to be able to know and see that across the board, especially for people that have autoimmune issues, or allergies or sensitivity issues to things like that. Test, to me, that was such a good one. I'm actually glad you brought that up, because that's a really good one they've been able to just release here in the past couple years, that I think is a really good one.
Well, and when you read it, yeah. I'm curious. The first time I saw one of those panels reports, I was a little overwhelmed.
Oh yeah. Listen, there's so here's the other great thing they do is then you get a secondary report. Like then it kind of takes all of that information, and on the one that I did, it then said, okay, here is red, you just shouldn't do. Here's yellow, kind of be cautious. Well, then here are your green foods. And so it actually took all of that info and did that for me, or a practitioner could do that for somebody as well if they go see a functional med practitioner who does Rupa. But that's yeah.
So you got to come to her next boot camp with us. You bring your results to the 6 weeks, and then you get an hour a week with Cheryl, who created the test, to teach you about what it means, which is wild, because she really goes into like the immune system pathways. I mean, I'm sitting there and I'm taking notes.
That's amazing.
And I'm like, man, she's so brilliant. And she gives you insights. Like, it's hard to put everything on a couple pieces of paper. There's things that you're only going to get from listening to someone who's been doing this for 20 years. Right. And so what's cool is, as a practitioner, you could take that test and then go through that 6-week course. And how much better prepared are you going to be to figure out, okay, when would I use this test for a client? So that's been missing a bit, I think, in functional medicine. We don't often encourage practitioners, hey, try this on yourself, heal yourself. Spend time with the person who's the expert in this. Ask them your questions, right? And to me, that's how we heal the world.
Yeah, if you're a health practitioner on here, You should do all these testing on yourself. That's what I do. I do all this testing on myself. Dr. Molly, a friend of mine, we're always doing this. I just had somebody, again, I just did this this was last week. I did, did a full panel, did that. That was, and then the month before I did the allergy, the sensitivity panel. Mm-hmm. So anyways, I love this stuff. And I want to encourage you, again, you're a practitioner. If you're a practitioner, go to Rupa Health, rupahealth.com. And I'm just talking about Rupa. I know you're connected there. And listen, Quest does some great things. LabCorp does some great things. There are other organizations. But the thing I love about Rupa is you guys are the most cutting edge. You are really doing a great job of doing testing of things that a lot of people don't test for. It's incredibly comprehensive, and your doctors are well trained there as well. And so if you're a person, anybody listening to this, if you want to get any type of testing done, it's cool. Just go into the site too. You can kind of start to find what type of test might be good for you. If you go to Rupa Health, rupahealth.com, you can check it out there as well. Well, Dr. Kate, I want to say it was really great having you on. And appreciate you sharing your wisdom. This was fun, kind of doing a master class here on lab testing and and all things regarding what we should be testing for.
Thank you so much for having me. Like I said, we at Rupa love what you're doing in the world, and we are happy to support your mission in any way.
Awesome. Well, everybody, again, I want to say a big thank you to Dr. Kate Henry. Remember, she's the head of medical education at Rupa Health. She's also a root cause medicine practitioner. She's helped a lot of people get healthy, finding the root cause of disease. Obviously, we've been talking about lab testing today. Again, if you want to get lab tests done, you can go to rupahealth.com. There's other things. Listen, there's a lot of other great places out there, but Rupa Health is where I like to go, and a lot of the root cause medicine doctors that I go to really find out the root cause to be able to help people reach their optimal level of health. Hey, if you're not subscribed here to the podcast, make sure to subscribe here as well. And again, thank you so much, Dr. Kate Henry, for being part of the podcast today. Thanks, everybody.